Hello, everyone, and welcome to Pride Action TV. My name is Kim Hunt, and I'm the Executive Director of the Pride Action Tank. The Pride Action Tank is a project incubator and think tank focused on action that leads to improved outcomes and opportunities for LGBTQ people. Our mission is to improve the health, safety, and progress of individuals and groups within the LGBTQIA community by inspiring, supporting, and leading collaborative action that improves policy, service, access, and community dynamics in the core areas of housing, health, safety, financial security, youth, and aging. And Pride Action Tank is a project of the AIDS Foundation of Chicago. So our guest today is Melissa Josephs from Women Employed. Welcome to the show.
Thank you.
I'm just going to read your bio right quick, and then we'll jump into this just to give folks a sense of who you are. So Melissa is Director of Equal Opportunity Policy at Women Employed, where she has expertise in a range of workplace issues such as paid sick days, sexual harassment, fair wages, work and family, and affirmative action. A member of the Women Employed staff since 1990, Josephs promotes passage and effective implementation of equal employment opportunity laws and regulations at the local, state, and federal levels. And examples of the issues Melissa has worked on include campaigns to increase the minimum wage and pass paid sick days legislation locally in Illinois and at the federal level, and campaigns to strengthen anti-discrimination laws such as the Equal Pay Act and the Pregnancy Discrimination Act. Wow, that's a lot.
I've been there 27 years.
Yes, you are truly a veteran. So I know I read your bio, but just tell us a little more about who you are and the work that you do, and what Women Employed is, because I think that's an organization that's been around a while, doing a lot of good work.
That's correct.
But not everyone knows who
Okay,
they are.
yeah, thank you. And thank you for having me. So Women Employed is a 45-year-old organization.
45?
Yeah. And I always sort of joke that I'd like to work myself out of a job, because it would be nice if there wasn't discrimination, things that we had to work on, that everyone was treated equally. So slowly we're making progress. Our goal is to improve workplace practices, to reduce barriers to economic equity. And as you can tell from my bio, we work on trying to accomplish that, ideally at the federal level, but if not at the state level or even at the local level. So we were able to increase the minimum wage in Chicago, and same thing with paid sick time, and we're working on doing that at the state level and federally as well, because as we're going to talk about, I know today we're talking mostly about paid sick time, it's so important, at least having a minimum standard that everyone be able to earn some amount of sick time, because we're all going to get sick.
Yeah. Just curious, are there like sister organizations of Women Employed?
No, not really. We are Chicago-based,
Okay.
And we do national work, and we work with a lot of colleagues nationally. So groups like the National Women's Law Center, the National Partnership for Women and Families, and Institute for Women's Policy Research, and American Association of University Women. I hope I'm not ACLU. I don't want to leave out any of our partners. Yeah, we are just Chicago-based.
I see. Okay. It's a lot of work for a Chicago-based organization. Okay, that's wonderful. So you mentioned that we're going to talk about paid sick time, and Pride Action Tank is working with you on one aspect in particular of the paid sick time, and we'll talk about that a little later. But first, let's kind of lay the groundwork of why folks worked on this issue and why having paid sick time is so important for folks.
Because everyone's going to get sick at some point. And if you're working, you should be able to stay home and take care of yourself. But if you don't have sick time, you're afraid of losing pay, you're afraid of losing your job, so you go to work sick. And that's not good for you. It's not going to help you get better. It's not good to work. You're not going to be as productive, so your employer probably doesn't want you there as well. And you could infect coworkers, you could infect the public. But the alternative, if you don't have sick time, if you stay home, if you're sick enough, or if you have a family member who's so sick you have to stay home and take care of them, is that you don't get paid, and you could get fired, because if you work somewhere that doesn't give you paid sick time, you're just not coming into work. And I don't think the employer cares whether you're staying home and waiting for the cable person to come or you're sick. You're just not there, and
Good point.
they could fire you. And the reason we worked on this in particular is that about 42% of the population, both in Chicago and Illinois, have no sick time, not one sick day. So it's not quite half, but it's a big
lot.
amount.
Yeah.
And those are mostly low-wage workers. So in the lowest quartile, that's about 80% that have no sick time. And in particular, in industries where people are in touch with other people. So in retail and fast food and restaurant. And again, as we're talking about, do you want the person who's making your sandwich or lunch to come into work sick? I'm not blaming them if they do, but as I said, it's very possible they have to work, and so that they could infect the public. And so for that reason, it is so important that there at least be a minimum standard, similar to how we passed the minimum wage years ago. And most employers pay higher than the minimum wage, but we need at least a standard. And this is the same.
No, I remember many days just growing up when my mother would go to work ill, or when we would be sick. I had two siblings, and I remember her joking with her friends that she wished we'd all get sick at the same time, so that she wouldn't have to take multiple days off because she lost pay every time she stayed home to take care of us. So that's very important for folks to have that. So with this new law, who is covered?
Okay. So the law that went into effect in July of this year is in Chicago and in suburban Cook County. And it covers all size employers. So if you have one or more, everyone is covered. There are a couple of exceptions, which I'm not going to get into, like maybe a particular city agency or something like that. But all private employers are covered. And whether you work part-time or full-time, you are entitled to earn some sick time. And I use the word earn because that's the way this policy is structured. It's not that an employer has to hand out a certain number of sick days. You're able to earn 1 hour of sick leave for every 40 hours that you work. So if, for example, you work 40 hours a week, it's going to take you'll earn 1 hour every week, so it's going to take you 8 weeks to earn 1 day, 40 hours. And so then it will take you 40 weeks to earn, you're able to earn within a year up to 40 hours or 5 sick days. It'll take you, if you're working full-time, it'll take you 40 weeks, almost the whole year, to earn just 5 sick days. So if an employer is already offering you more, if your employer is already offering paid time off and you get many weeks, and you can obviously use this, they don't have to add anything more. But this is just the minimum standard. And so the example I gave was if you work full-time. But as I said, this covers everybody, whether you work part-time or full-time. So no matter how many hours a week you work, you earn the accrual is going to be the same. You're going to earn an hour for every 40 hours you work. It may take you many more weeks to earn what someone earns who is working full-time, but you're still able to earn it and use some sick time. And you don't even have to take 1 full day. The law says that an employer can allow you to take it in a 4-hour increment. So because it takes you so long to earn sick time, they shouldn't make you use up a whole day if you don't need a whole day. So you might need a doctor's appointment that's only half a day, or maybe you're feeling sick in the morning and then you feel better. And so you are able to take it 4 hours at a time.
So you mentioned part-time folks can earn sick leave. So how is that tracked?
Right.
If they have multiple jobs, for example.
Right. Well, if you have multiple jobs, you still are only able to take time off for the amount that you've earned at each
At that
employer.
employer.
Right, so
Okay.
even if you, let's say, worked 40 hours in a week, but it was at 3 different employers, you're gonna have to split it up, because no one employer has to allow you to take time that you earned working for a different employer. And I will say, in terms of tracking, it should be easy enough to figure out how much you've earned, because you can just take your paycheck and however many hours you worked in a week, or whenever you get paid, just divide it by 40, and then you figure out how many hours. But I will say, and I will probably say this many times during the session, we have a great website, which is
There
very
you go.
very easy to remember. It's just sicktime.org. If you go there, there's a lot of information about the law, a lot of what Kim and I are talking about, but one thing that's really great is we have a calculator up there under tools and resources. You can drop down, and that's the first thing you're going to see. And literally, all you have to do is put in the number of hours that you worked, and it'll tell you how many hours you've earned.
So this isn't necessarily on their pay stub.
That's correct.
Okay.
It's not.
Okay, I got you.
The amount of hours you worked should be,
Right.
And then you can just divide by 40. But for people who don't want to divide, just want to go online, you can go to sicktime.org, go to tools and resources, go to the calculator, and it will tell you how many hours you've earned.
Nice. And we've played around with that calculator,
Yeah?
the staff and I, so that's
Does it
it's
work?
a handy tool.
Okay,
Yes,
good.
it's and that whole website is really great. So I encourage people to go there if they have any questions about this or want an overview or a refresher as we go through this discussion. So one of the exciting things in this new law is this expanded definition of family. And tell people what that means, and I hope people are excited
Yes.
about that as I am.
Yeah, I'd be happy to. So this law already provides a lot of reasons that you can take sick time. So if you are sick or have a medical appointment, or you need to take care of a family member who's sick or a medical appointment, or if you're the victim of domestic or sexual violence, like if you have to go to court or therapy, or if there's another polar vortex, if there's a public health
Could happen.
emergency. Yeah. If there's a public health emergency where, let's say, your child's school is closed at the last minute and you can't find a babysitter at the last minute. So you're not sick, but you need to stay home and take care of a child. So those are all reasons you can take sick time under these ordinances. But to Kim's point about the broad family definition is we wrote into this ordinance a very broad family definition, and you can go to the ordinance, and we'll put the broad definition on the website as well. And I'm not going to spend a lot of time going through it, although it includes everything, not just parent, spouse, child, but child, whether they're biological or adoption or foster care. Same thing with, with if you're how a parent is defined, domestic partner, godparents, godchildren. So again, I'm not going to go through every single example because it's not even a completely inclusive list. The definition lists those as examples, and then it says, or anyone who is related by blood or the equivalent of a family relationship. And so it could possibly be a neighbor who you're taking care of, lives in the same building. Maybe you don't have blood relatives, but that person has become a relative who either takes care of you, needs to take time off, or you take care of them. And so it is not a finite definition, and I think there's nothing in the law that's going to require you to define the person to show that there's any relationship. First of all, you're not taking that much time off, and when you do, the employer, probably shouldn't even ask you why you're taking the time off. But you should know. This is why it's so great, Kim, that you're talking about this to get the word out. That people should know going in that they have this right. And that they have this right not just for themselves, but for someone who is considered a family member, whether, as I said, whether they have to take the time off to care for somebody, or whether you're the person who's sick and the person you're related to or you consider a family member needs to take time off to take care of you. So I definitely want to get the word out there because, we're not all like nuclear families, and we don't
Right.
just have a parent, a spouse, a child, we have lots of relationships. And again, as I said, this is such a minimum amount of time off. You're only allowed really up to 5 days a year. So it just, it shouldn't matter. But anyhow, that's what the law says. Does that make sense?
Yeah, it makes sense to me.
Yeah.
And I think it's important for people to understand, especially LGBTQ folks, that this means chosen family. And we know that a lot of, for LGBTQ individuals, this issue of chosen family, being able to, or having an acknowledgement of chosen family as family is hugely important, because in some cases folks that are no longer connected to their families of origin, and for many folks who may not have gotten married but have been in long-time relationships with partners and are essentially married, this is hugely important. And LGBTQ folks are more likely to have this situation than the broader population. There was a study that came out by Center for American Progress, and it's folks with disabilities and LGBTQ folks who are most impacted by this broadened family definition, and really the need to expand this broadened family definition to many other policies just across the board. And that reminds me, I know you mentioned that this law is in effect in Chicago and suburban Cook. So it's not statewide.
Not yet.
Not yet. I was good. But you're working on it.
That's correct. There's a bill in Springfield that we've been working on for quite some time. And the current bill we've actually adopted so that it is very similar to the Chicago and Cook County law that passed, just to make it easier, so that when it does pass in Illinois, it's going to be consistent. So again, it'll cover employers of all size. It'll be for all of these definitions, all these reasons for leave. We have a broad family definition in that bill as well. It's the same kind of accrual. It's very similar, and it is important that it be statewide. Because it's something that's needed by everybody. And then there's some issues, I will say that it's been a little bit controversial in Cook County, and there's some suburbs in Cook County that have opted out. And even those suburbs, we're trying to get them to opt back in. But I think one of the reasons they have some concerns are border issues. They're saying, why should I provide sick time here and, someone across the street isn't? It might be harder for the employer. Again, this is such a minimum standard. It's not costing much, if anything, because oftentimes when someone takes leave, it's not like the employer has to replace you. Sometimes someone's work can wait, or sometimes someone who's working can do work for you. They can reassign it. So it's not like they have to pay two people. So it's not costly. In the cities and states where this has been law for a long time, it's shown it's just a teeny percent cost. But that said, there's still some suburbs that wanted to opt out, and so that is what a lot of them are pointing to. And while I don't like that they opted out, it is correct. This should be statewide. It should be nationwide, just like a minimum wage.
Yeah. And just to clarify, the impact is based, or the law is based on where the employer is.
It's actually based on where you're working.
Where you're working. Yeah.
So if like I work in Chicago, my employer's in Chicago, that's easy. But a lot of times your employer might be based in the suburbs, and if it doesn't matter if that's a suburb that opted out. If you're working in the city of Chicago, you're entitled to the minimum wage in Chicago. You're entitled to the paid sick time. So a lot of employers that are national have been dealing with this on a lot of other laws for years. They'll find out that a particular law in a state in which they're in passes, and they know they need to comply with that, whether it's the minimum wage or other benefits. So this is the same thing. The easy thing is it's where you're working. It's not necessarily where your employer is. So so that's easy for the employer to, for the employee to know what they're entitled to.
And you suspect there might be some issues, as for some folks who may be employed somewhere where maybe the employer doesn't quite know that this is happening, or there may be some discrepancy on the tracking of the hours. How can folks deal with situations like that?
Yeah, so employers should be posting a notice. It's a requirement, just like a lot of other laws that you probably, maybe in the employer's kitchen or in a hallway where it says what the minimum wage is and what other laws are. So both the city and the county have created a one-page notice that explains this law, and so they should be following it. But if they aren't, you can certainly bring it up to their attention, to Human Resources attention, and if you're not comfortable doing that, you can call the enforcement agency. And so in Chicago, there's no Department of Labor. So an agency called Business Affairs and Consumer Protection that does a lot of licensing for employers, that's the agency that's enforcing this law. If you can't remember that, you can easily just call 311. And whoever picks up, you can just say, I have a question about paid sick time, or I want to file a complaint about paid sick time, and the 311 person will direct you. For Cook County, that is being enforced by the Cook County Commission on Human Rights. And that's the agency that enforces anti-discrimination laws. And so that makes sense. Again, in Cook County, there's no Department of Labor, but that enforcement agency makes sense. And there is a direct line and there's an email, which I don't have memorized, but if you go to the sicktime.org website, see, it's so easy to remember. You don't even have to put in a city. Just remember sicktime.org. And again, under tools and resources, so right below the calculator, which as we mentioned earlier, that's the first thing you'll see, is the links to filing or asking questions, downloading a complaint form for both the City of Chicago or for Cook County. And so they'll give you all the links to where you can find a website, a phone number, an email, and you can just call with a question. You might not be ready to file a complaint yet, but they can help you. If you're not ready to just go directly to your employer, you can. It's possible. I have to say, we've been doing a lot of outreach on this, and there's been a lot of media. So a lot of employers know they're supposed to be doing this, and they have to maybe adapt policy that they currently have. A lot of employers don't have to adapt the policy because, as I said before, if they're already offering it, they don't really have to make a change. The one thing I do want to say, though, is that sometimes employers that have policies might have some kind of a discipline that's involved with the policy. People might have heard that maybe they didn't give enough notice, they get a check mark. And under this law, they're not able to do that because, as we talked about with sick time, when you were saying your mom would like it if all the kids got sick at the same time. Well, it would be nice if you knew what day you were going to get sick, but usually you don't. And so if you have to call in at the last minute, you plan to go to work, but you're just too sick to come to work, an employer cannot discipline you. You're allowed to do that. If you do know, you're going to be in the hospital, there is a notice they'd like, if you know up to 7 days in advance, you should give it. But if you don't know, you're not required to give it. Just let them know as soon as possible, even on the day of, that you're sick. And you're going to be allowed to take the sick leave if you've earned it, and the employer can't not discipline you.
Okay. You mentioned that you're working on a bill to expand this across the state. Is there anything that folks can do to help you, or a place where they can find information?
Yeah, so for the paid sick time law, it's slowly making its way through the legislature, and there's just some adjustments that are being made. So you can certainly call your state rep, call your state senator, and just say, I support the paid sick time bill in Illinois. And to get more information about that, so instead of going to the sicktime.org website, if you go to womenemployed.org, we have a lot of information about the Illinois paid sick time law, and we'll link you to fact sheets and take action.
Okay, and it looks like we have a caller. Hello, what's your question or comment?
Yes, is the employer required, and I just found out today that we get sick time, is the employer required to post your sick time on a board or anything like that?
You mean the amount of sick time that you're entitled to?
Yes, ma'am.
They're not required to post it. No, there are some cities or states, the laws have said when you get a paycheck, they're supposed to be keeping track. So the Chicago and Cook County do not. And so the way you, I mean, eventually they're supposed to be tracking it so that if you did file a complaint, if someone came in and talked to the employer, they would have to keep track of it. But if your question is, are they required to keep you apprised, like with every paycheck? No. So the way you can figure it out is, as we were saying earlier, if you just track what your hours are, all you have to do is divide it by 40 to figure out how many hours you've earned. So can I ask you, are you an hourly or salaried employee?
I'm an hourly.
Okay, and so are you able to track your hours just based on your paychecks because you get a paycheck?
No,
And,
I work for McDonald's, and they, you know, if you take it out, you can take it. I've been working for them for about 10 years. They never told me anything about, I get sick time. I said, no, you have no benefits at all.
well, so this law just went into effect in July
July.
of this year. So maybe before July, you were not entitled, I mean, if they weren't giving them to you, they weren't required to. And do you work in Chicago?
Yes, I do.
Okay, so, yeah, so as of July, you have to have, in order to use the sick leave, you have to have at least worked somewhere for 180 days, so 6 months. And it sounds like you've definitely met that. You said you've worked for 10 years. And so since July, you've been accumulating hours based on how many hours you work. So if you just want to go back to July and you can like look through your pay stubs or paycheck and figure out how many hours you work, divide it by 40 to figure out. Or you can ask your employer. You can ask them to tell you how many hours you've accrued. But no, they're not required to tell you on a regular basis.
All right. So thank you for your call. And it looks like we've just got a couple of minutes left. So I want to thank you, Melissa,
sure.
for coming on and remind people to go to sicktime.org
Yes.
if they have any questions and the information about who to issue a complaint to is on there.
necessary.
If you need to do that, let's hope you don't need to do that, but sometimes we need to do that. And I just want to let folks know that next month we will be talking about open enrollment. But I will say now, since I have you, the Affordable Care Act is still the law of the land. And open enrollment, if you are getting your insurance through the marketplace, is November 1st through December 15th. So make sure you go to healthcare.gov to look through the plans. AIDS Foundation of Chicago will also have plan assessments available soon for those who are concerned about their HIV medication and prescriptions and that sort of thing. So we look forward to seeing you next month.
That's a perfect
Bye-bye.
connection.
Yes.